So we're checking this patient here to see if he's got enough tissue to do the glutes for our pellets. As you can see, a previous pellet insertion at another office where he actually extruded from, probably because he doesn't have enough tissue. So I'm gonna have you actually roll over. Let's take a look at your abdomen. Let's see if you probably abdomen. Still mostly skin. There's some fat here. So typically when we do the abdomen, we find the superior iliac crest here as our landmark, staying away from the inguinal ligament and marching out towards the navel. He just doesn't have enough fat in this area. If we tried to place these pellets, I fear they'd extrude. So we're gonna try starting at his navel here and marching out laterally where there's a little bit more subcutaneous tissue for our pellets to sit. So I'm just gonna mark this patient because I'm sitting on this side of him. We're gonna march out that way today, and on his next visit, we'll alternate different sides of the abdomen. So we're gonna make an incision just inside the navel here. And then we're gonna march out probably this direction. And for men, we use a lot more pellets, so we have to do kind of a triangle, if you will, and we're going in different directions here so that our pellets don't stack and create a bulge. So probably make our planes in this direction. And you'll see when we do the lidocaine as well, followed by the trocar, the different direction of our pellet placement today. A little bit of a prep here. I'm gonna cover the area that we're making our incision, clean all the way out, and see how you can still see where all my markings are. So we're gonna drape our area, keep it nice and sterile. Give this nice fenestrated drape that's gonna go right over where we're working. So now this is nice and clean area that I can touch and work with if I need to. So we're gonna start by making what's called a wheel with our local anesthetic. So it's a lidocaine with epinephrine, a little bit of bicarb to help bite the burn. Really driving the hub. And what that means is once I get to the end where I'm numbing, really forcing that numbing medication out into the tissue so that when the pellets are placed at the end of my trocar, they're popping out to where it's already numb. All right, so I'm just gonna see if my patient feels this. Feel anything here?
No.
Okay. I'm gonna make a small incision inside the navel here. Doing all right?
Yep.
You can pull this first guy out with a sharp tool. And we want to bring our kit nice and close to where we're working so we don't lose any of our pellets. And for the women, as you remember, we put them all in at once. For men, it's a little bit different. And I'm going to do one at a time. Remember I told you about that blunt tool that we'd be using, so here it is. And so because we do so many pellets on the men, we start at the 12 o'clock position here for this first guy and deploy him. And now we're going to my 6 o'clock. So now I've put in 4 pellets in this first track. So we reinsert the sharper of our instrument so that we can reposition where we're at so that we're not stacking the pellets. So we're going to come back just ever so slightly. advance to another position. Again, starting in that 12 o'clock position, we pull out our sharper tool. Bring our tray nice and close to us. There's our pellet. And with our blunt tool. And this one, if you can tell, is a little bit smaller. The last pellets were all 200 in the testosterone. This is 100. We'll place our last pellet. It's in. Remove the trocar with these. And that's a procedure. A bit of DermaBond over our incision here. We will have him keep it dry with a occlusive dressing for 1 week. So no crunches this week, sir, please. But you can shower and you can get it wet because we're going to have a nice dressing in place. We also, for our male patients, put an ice pack on. So we need to keep this ice on for the next hour at least. If you're having any discomfort, take it off, rewrap it, put it back on. You can wear it throughout today. As you can see, minimal bleeding. So here we have a nice clean dressing over the incision where we have the DermaBond underneath. That DermaBond will protect the incision from getting wet, getting infected over the next week. So just no crunches today, no super strenuous exercise, but he can go to the gym and do his, some basic exercises even tomorrow. So we're gonna put some ice over the area as well. He will keep on for the next hour at least. He can go ahead and take these dressing off tomorrow as well. And that's how we do pellets here at Orange County Plastic Surgery in Newport Beach, California.